Start. Okay. And it is recording, which is great. And I see that we have some attendees already joining us. Thank you. Welcome. We're going to give everyone a few minutes to join and log in before we get started. Hello, hello, everyone. My name is Maggie. So nice of you to join us today. Thank you so much. We're going to give people just a few minutes to get settled and join in before we start our webinar today. If you'd like, while we're waiting for others to join us, feel free to let us know where you're joining from. Maybe what's the weather like? I know it's been super hot here in Los Angeles, but I'm guessing it's been like that across the country. So curious, what weather are people having? Long Island is hot. I hear you. Is it also humid out there in Long Island? Vancouver. Hi, Tammy. Oh, beautiful 70s. Oh, I'm jealous. Beautiful 70s in Vancouver. Ah, not today. Okay. Yeah, Los Angeles. Yeah. I know they keep talking about rain in LA, but I don't know. I don't know if it's not here yet. At least looking out my window, it's not. Doesn't mean it's not on the way. Going to give everyone about 2 more minutes, 3 more minutes maybe, because sometimes people might have a trickier time logging on depending on where they're joining us from. Oh, okay. We do have live interpretation today for our webinar, and we will be giving some instructions shortly, but there is a message in the chat from our interpreters. If anyone wants to check the chat, there is some information there. Sorry, I thought that was in the main chat, but I don't think it's there. We're going to try and get that there. Okay. I think what we will do is we will go ahead and get started. Before I introduce our moderator, I'd like to just go over a few housekeeping things for today's webinar. And we are offering live Spanish interpretation for this webinar, and I'm going to ask one of our interpreters to please join us to give further instructions on how to choose that option for this webinar.
Buenas tardes a todos. Solamente queríamos avisarles de que tenemos servicio disponible para español. Si usted busca la parte donde se encuentra un globito, lo aprieta para escoger inglés o español para su conveniencia. Espero que lo disfruten.
Thank you so much. Also, just a reminder that we are recording this webinar and it will be available afterwards as well for those who may not be able to stay the whole time or want to go back and rewatch it. And there is a Q&A option at the bottom of your screen. You can feel free to place some questions there, but also know that there will be some time at the end for a Q&A, and that a lot of times our questions do get answered along the way by our panelists and guest speakers. So without further ado, I'm going to introduce our moderator for today, Ginger Webb from Aurinia, and who will then introduce the rest of our panelists today. Thank you so much.
Thank you, Maggie. Well, welcome to our patient and physician panel discussion. We're here today to hear authentic personal experiences from our patient ambassadors and physicians to inform, activate, empower, and support other patients and care partners in their journey with lupus nephritis. We will be discussing lupus nephritis, including the journey to diagnosis, treatment and management options, day-to-day life, and working with your healthcare team and your support system. We have with us today Melissa, Jennifer, Dr. Clayton, and Dr. Levin. Thank you all for being with us today. So let's get started. Let's begin our discussion with a bit about lupus nephritis. Dr. Clayton, can you tell us a little bit about it?
Sure, thanks. So happy to be here with everybody today. So lupus nephritis is inflammation of the kidney, and the word nephritis comes from nephron, which is the filtering unit of the kidney, and itis means inflammation. So the lupus itself is attacking the kidney and its filtering mechanisms. This is one of the more serious manifestations of lupus and life-threatening manifestations of the disease. And it probably affects about 45 to 50% of patients who have a clinical diagnosis of SLE or systemic lupus. It can cause permanent and irreversible kidney damage, which is the feared complication. And that can be as mild as just having an abnormal kidney number, but it could also be as severe as needing, having complete kidney failure and needing dialysis or a transplant. So this is a manifestation of disease that needs to be monitored for and diagnosed very early and then treated very early.
Thank you. So Jennifer and Melissa, what did you know about lupus nephritis before you were diagnosed? Jennifer, would you like to start?
Sure. Actually, nothing. To be honest, when I was first diagnosed, I didn't know there was a difference between lupus and lupus nephritis.
Likewise, Ginger, sorry. When I was originally diagnosed with lupus, I had no knowledge of it. I was educated more about it once I received the diagnosis.
Thanks. Well, will each of you tell us a little bit about your story and how did your symptoms first present to you? We'll start with Jennifer.
So I was traveling when my lupus symptoms first appeared. I started to get some swelling in my legs, and at first I thought it was from mosquito bites because I'm really allergic to them. But then the swelling started to spread to the upper part of my body, and I realized that there was something really wrong. So when I got back from my trip, I ended up in the ER, and I found out that I'd gained more than 20 pounds in a few weeks. And so while I was at the ER, they couldn't quite figure out what was wrong with me. So I had multiple tests done, including blood tests, a urinalysis, and finally a kidney biopsy. And after I went home from the hospital for a few days, the doctor called to tell me that I had lupus nephritis.
For me, Ginger, it started when I was in graduate school, when I began to notice that I was overly fatigued. I saw specialists who eventually gave me some supplements and nutritional supplements, and then the symptoms subsided a little. Then a few years later, my baby sister passed away, and before she died, the doctors had diagnosed her with lupus. And not like shortly after, not too long after, I experienced my most painful symptoms yet, and I was still fatigued. I experienced misdiagnosis, and some of the diagnoses that I received, it went anywhere from carpal tunnel syndrome to rheumatoid arthritis. Desperate, I decided to seek out a dermatologist because I was going through a lot of symptoms such as joint pain, itching, hair loss. The dermatologist examined me and ran some tests, and that's when I finally was diagnosed with lupus. And then a few years later after that, I was seen by a rheumatologist who found protein in my urine, and I had a kidney biopsy, and that's when I was diagnosed with lupus nephritis.
Thank you guys for sharing that part of your story. I know that was just the beginning of your journey. So I would look to Dr. Clayton and Dr. Levin. How do you typically see patients present with lupus nephritis? And how is it usually diagnosed?
It's a great question. And like so many other issues that affect the kidneys, sometimes people can have these conditions and not even know. When we have protein in the urine, abbreviated noted as proteinuria, the protein itself can be foamy, can be frothy, can be sudsy. So some patients may say to us, listen, I went to the bathroom the other day and the bowl was filled with bubbles. To us, that's a sign that we're losing protein. On top of that, we can get progressive blood pressure involvement and swelling. So issues of high blood pressure and leg swelling, as described before by the team with this weight gain, is also very common. As this can go on, that's when we get the scarring of the kidneys and inflammation. And if caught early enough, it can be reversible with medications. So what we do is we look at 3 different ways. We look at the urine test, looking for foam, bubbles, and suds, and trying to quantify how much protein is in there. Also, these blood tests, these serum tests, looking for the creatinine, which is really a measurement of kidney function, can determine how well the kidneys are working, with in mind that many times, and we hope this is the case, people who do have lupus nephritis, if caught early enough, their kidney function can be normal, they can have protein, and a great indication that they'll respond to reversal. Finally, as also said before, that the biopsy really is the hallmark. knowing that there are different classifications of lupus nephritis between rheumatologists and nephrologists working together, the biopsy really becomes the quintessential way of making that diagnosis and figuring out what's next in the course of having success.
So Militia, once you were diagnosed, how did that change things in your life?
Yes, Ginger, it was a relief, but also very terrifying. Of course, I was able to get the medications that I needed to be able to deal with my symptoms. However, the only people that I knew who ever had lupus was my sister and another young lady that I grew up with who died of this disease. So at that point, I was willing to like change my life and change my perspective, the way I ate and slept, but I constantly worried if it would be enough. Even though I was scared, I always felt like my doctors were on my side.
That at least had to give you some comfort, right? So I'd like to ask Dr. Levin to introduce a treatment option for lupus nephritis.
Sure, and again, we're glad to be here for this. So we're talking about Lupkynis, which is voclosporin. It's a prescription medicine that both physicians use, nephrologists, rheumatologists in combination as a teamwork here to help treat lupus nephritis. And the great news about it is it's an oral therapy, can be dosed accordingly based on people's kidney function. But like any other medicine that exists, even medicines that we have experience with, there are some side effects. So while all medicines that work on the immune system have some effects of causing infections and cancer, things that we look out for things that we look out for and help hopefully stay on top of, the most common infections of lupkynis can be diarrhea, headache, cough, urinary tract symptomatology or infections, non-specific abdominal pain, and sometimes in certain people, loss of hair, which is alopecia. There's always important safety information will go on as the time goes forward. And for thoroughness, there's this website, www.lupkynis.com, that has all the full safety information that we want to go over.
Thank you so much, Dr. Levin. I'd like to know a little bit more how Jennifer and Militia learned about Lupkynis. What did you discuss in your initial conversations with your healthcare providers? Jennifer, would you like to start this one?
Sure. I was actually on a previous treatment plan that really wasn't working well for me. And then the pandemic hit, and I started to develop this really unhealthy obsession with what my life was going to be like if I didn't get better, or if this pandemic lasted for years, which of course it did. And just as I started to go down a really dark hole, my doctor suggested that we try a new drug, Lupkynis, to treat my lupus nephritis. It had just come on the market a few weeks prior, so we had discussions about the details about the drug as well as the potential side effects, and then we decided to move forward with it.
Yeah. Militia, how about you?
Sure, likewise, and I will piggyback on Jennifer's response and say that, you know, I was going through a lot at the time with the symptoms, but I felt strongly that my healthcare providers and my husband, who also is a very big advocate in my treatment, and he advocated for me in my appointments, that I felt like we were a team. I tried to bring him along with me as an extra set of ears too when I could. Together we discussed various treatment options, but the first one that I tried was not the right fit for me. After sitting down and talking again, my team and I chose to include Lupkynis in my treatment plan.
Yeah. So Dr. Clayton and Dr. Levin, tell us about how you bring this conversation up with your patients. What does the first discussion around treatment typically look like?
So I think it depends on the patients, honestly, the specific patient you're talking to. We try to do in rheumatology, because lupus is a systemic disease, we try to do a lot of disease education when we first make a diagnosis like this to kind of empower patients to understand what's possible. And when it comes to kind of talking about how to treat a lupus patient, you really need to focus on what you're treating symptomatically, right? So treating nephritis is very different than treating an inflammatory arthritis. So you kind of focus your therapy on what that specific patient's disease state is and what their needs are.
Dr. Levin, did you want to add anything?
Yeah,
Anything
I think
more?
Sure. Again, I think this is really exciting. And I say that because to have such a vigorous therapy that exists in an oral form makes us as clinical physicians happy. And without a doubt, what everyone said about this being a team approach is crucial. And both Dr. Clayton and I, when we had reviewed this, really appreciate the importance of a multidisciplinary attitude, that doctors are talking to each other for the benefit of the patients. And as Melissa said, having that support team is so important. In the population that I treat, I think I'm open to everything, which means this is not a salvage medicine. This is not a third, fourth, fifth line medicine. They just globally considering two different populations. One are patients who have been on other medicines that they've had and not had the success we'd like to see. And others that are new to this diagnosis with these kidney biopsies, proteinuria, and the rheumatological aspects who may benefit from this as well. So we don't have to use this in our line of work as third, fourth, fifth. We can use it for people who haven't responded to other therapy, or use this as original therapy looking for success. So keeping these options open, giving information, supplying the handouts and the educational supplements really just leads to a great discussion that can occur.
I would just reiterate that too and say that, it's never great to tell someone they have lupus, but if there ever was a time to have treatment options and very effective and patient-friendly, meaning oral type medication options for them, I think this is a really exciting time for lupus because of LupKinase, honestly. So.
Thank you. Thank you. Well, I'm going to turn to Jennifer and just ask, now that you've started LupKinase, can you tell us how that's going?
Yeah, sure. My routine right now is that I take 3 tablets twice a day, and I try and take them on an empty stomach once before breakfast and then again once before dinner. In the beginning, I have to admit, it was hard to remember to take the pills at the right time, but I've gotten better at it. I started incorporating them into my daily routine. For example, I take the pills the first thing in the morning before I feed the dog and make breakfast, and then I take them again when I start thinking about dinner. And after I started taking LupKinase, my first set of test results, including blood work and a urinalysis, actually showed improvement.
Wow, so that kind of helps reinforce the good behavior, right?
Exactly.
Yeah. Well, in talking about taking LupKinase, we also want to talk about Aurinia Alliance. So, Melissa, do you want to tell me, what do you know about Aurinia Alliance program and how have you used it and has it helped you?
Sure. When I first started taking LupKinase, I was assigned a nurse case manager through the Aurinia Alliance program, which is great. It was a great experience for me. She called me, she went over the side effects, the precautions, and dosing. She also helped me deal with insurance options and just like approval, getting the medication approved so that I can get my LupKinase prescription. And anyone that ever has dealt with new medications approval, that's just something that if you're stressed, you don't want to deal with that. Now she still checks in with me periodically to see how I'm doing and to make sure that I get my prescription on a monthly basis. She's been absolutely a joy and very awesome in my life.
That's great. Well, kind of keeping along those same lines, what other ways do you both manage your lupus day to day? We'll start with Jennifer.
So I am trying to be more gentle on my body than I used to be. So if I'm tired, I try and take it easy and not overschedule myself or push myself to work out like I used to. I'm still trying to exercise regularly without overdoing it, but it's been a little hit and miss lately. I'm also a lot more aware of what I'm eating, and I try not to overeat anything that I know is going to mess up my system. And that includes not really drinking as much alcohol as I used to in the past. Again, this is what I do, so other people might be doing different things or have other experiences.
Thank you. Thank you.
And yes, I totally agree with Jennifer. Since being diagnosed with lupus, I realized the importance of self-care. That is just ultimate to me to help me manage my symptoms. I've learned that stress, unhealthy eating habits, just lack of exercise or physical activity it just, it's just the imbalance. It emotionally triggers flares and instability in my life. Not, I can only speak for myself. Therefore, I've implemented some routines such as walking. I've modified my diet a little because I found that certain foods trigger my flares. I've implemented some self-care routines, such as I embrace my spirituality even more, doing things I love, relaxing and spending more time with my family, and finding ways to just decrease the overall stress in my life.
Yep.
And like Jennifer said, this is my experience, and it may be different for others.
Yeah. Thank y'all both for sharing that. I want to ask the doctors, are there any other ways you recommend to your patients on managing their lupus day to day? I mean, Dr. Clayton, if you want to go first.
Sure. So I share both of Jennifer and Melicia's points about this. I think it's really important to empower patients to be active. Sedentary patients do worse long-term of any disease in rheumatology, but especially in this disease. And sometimes that's hard, right? Like Jennifer was alluding to, it's really hard to push yourself to stay active because maybe your new normal isn't where it was before you had nephritis and before you were on treatment. But I think it's really important because that helps mental health as well, which is another part of all of this discussion that we probably underestimate, how significant a lot of what goes on in the diagnosis or the symptoms leading up to diagnosis and the workup is in affecting our patients' mental health, and then how that affects their disease state. So I try to really empower people to be active. I don't make a lot of set dietary recommendations because I'm a very evidence-based provider. And when it comes to the lupus literature, and even in all of our rheumatology states or diagnoses, we don't have a lot of firm guidance about dietary changes, but I try to have people make good choices, portion control, moderate amount of protein, healthy fats, kind of common sense type dieting, if you will, not dieting, but dietary recommendations. And then I really have them be empowered in their own care with following up on their own labs, making sure they're seeing all of these data points, because that's really the most important thing, because that's very gratifying and that feeds the cycle of patients actually being engaged and taking their meds and coming to their appointments. So when they see that progress and that improvement, I think it's really gratifying for them. So we try to encourage that.
Thank you. Dr. Levin, did you have anything to add?
Yeah, I think these are all beyond valuable points. Now, one thing as a nephrologist that we look at quite closely, besides the protein that we talked about, is blood pressure. So it's not uncommon with people who have lupus nephritis to have fluctuations in their blood pressure. And sometimes, depending on how severe, other medicines are used for that can also help reduce proteinuria. So from a dietary aspect, completely agree with Dr. Clayton. There are times that we'll talk about watching your salt intake because salt is everywhere. And we'll talk about things like the salt on your food or the salt in your food and how that's different on top of everything else. There are patients who we follow quite closely, and checking their blood pressures at home in a very low anxiety but informative way is quite helpful, because we all know that we're all happier at home, and your blood pressure at home is probably a little bit more controlled than your blood pressure in the offices. So we'll ask people to do that and keep a log of that. It's exciting, which I keep saying, but it's really an understatement. Usually people who have protein in their urine, which is a marker of a disease, shows us disease activity, and gives us an idea of who may be at risk of disease progression. The less the protein that's there, the more rewarding it is. And never in our careers have we seen protein dissipate so quickly. So while we have these dietary changes, while we have these activities, reducing stress, reducing protein is just so beneficial. And it's exciting to see this benefit go on. So the one thing that I stress to our patients, like everyone else said, is activity, mindset, blood pressure awareness, and sodium control, we'll say.
Thank you. Thank you for that. Well, just in keeping along the lines of looking at how the patients are managing their disease, what has your support system been like? Do you find that it makes a difference in your overall outlook and experience? Jennifer, would you like to start?
Sure, absolutely. I'm really lucky to be surrounded by my boyfriend, friends, and family who are extremely supportive and willing to just listen when I need it. I found it super helpful to start just talking to people about what was happening to me. And for me, reaching out and involving my community was one of the best things I could have done. Not only did it give me more perspective and support, but it also helped other people understand what I was going through. And that's been such a huge relief, because there were a lot of times when I felt like I was just letting people down, when I couldn't help them or just go to the things that they asked me to do.
Yeah. Thank you.
And for me, I believe that my support system has been pivotal to my healing process. Without the support from my immediate family, a great doctor, and close friends, I think things would be different for me. When I was newly diagnosed, my ability to function day to day has significantly declined. I couldn't do the things I used to do. My support system was able to step in and really help me navigate things. So having my support system helped me to gain my functioning back, and it gave me the courage to live and not just exist.
I love that when you say live and not just exist. That's wonderful. So what would you each tell someone else who is just starting on their own path with lupus nephritis? Jennifer, you want to start?
Yeah, I think I'd start with telling them to find out as much as they could about the condition, just to educate themselves. And then just to know that while it is serious, it doesn't mean the end of everything as you know it. Some things might need to change or be adjusted, but you'll still be able to go back to a lot of the things that you loved before and then find new ones too. Also, especially if you're like me and you rarely reach out and ask for help, I think it's really important to talk to your community about what's happening with you. It's honestly been one of the best things I could have done, not just for myself, but also for my friends and family.
Yeah. Melissa?
Yes, I would definitely tell them to find the right treatment approach and a doctor who cares and listens to their concerns. I like what Jennifer said about just educating yourself. I would also encourage them to utilize their support system, or find support groups that can help them navigate and manage their symptoms. That was very vital for me in the beginning, because you feel like you're alone, but you're not alone. This disease is a mystery, and at times your symptoms may change from time to time, but with the right treatment, good support, positive outlooks, things can change and you can still live your life to the fullest.
Thank you all so much. So when communicating with your healthcare team, Melissa, what do you find to be most effective and helpful when you prepare for your upcoming appointments? Is there anything you do in between appointments to help track things or for more effective appointment conversation?
Definitely, Ginger. For me, I have learned, and I'm gonna say this again, I have learned to keep a logbook of changes in my symptoms, because I didn't do it at the beginning, but I've learned because it changed from day to day. And I kept that logbook so that I can discuss them with my doctors or write down questions prior to my appointments. And this helped me to get a full picture of what I was experiencing because it changed from day to day.
Yeah. Does Dr. Clayton or Levin, do you guys have anything to add to that? Like what the dream patient coming in would look like to have conversations?
Now, from my aspect, I think it's all about honesty. I think it's creating an environment for the patient, irrelevant of what we're treating, that they feel comfortable telling us how they feel. They tell us what their concerns are. They tell us what their goals are. And we explain as clearly as we can what's going on in a language that they understand, and give them a chance to ask questions. So often in the healthcare world, we all feel rushed, both patients and providers, and giving the patient a chance to explain themselves, both physically and emotionally, their symptoms, letting them know that they're in a safe environment to get care goes a long way. Not even therapy related, just letting them know that we care about how they're going to do. That, I think, is beyond the most important thing we can do to start that relationship off. And as Dr. Clayton said before, this is a disease that affects the body. And one of the best things to do is mediate stress. And while we're seeing this amazing success with such a great agent, I think the stress reduction of being active, being exercising, eating a healthy diet, yoga, meditation, things along all these lines, instilling this lifestyle into our population and realizing that we're, as the physician, along for the ride is beyond important to do.
I would reiterate that point too. And I'd also say to the patients, to those of you who are on here who are patients, you know, rapport with your provider matters, right? So it's not a one size fits all. And I know I practice in a more rural area, so there's not a lot of options. And rheumatology specifically is a very underserved field. But I think you have to be in a physician-patient relationship with someone that you trust and that you feel like you can take what they're saying as truth, as Dr. Levin said. I think it's really important that we explain all the possibilities to patients and that you get all of the information and you have a good relationship with not just, you know, the rheumatologist, but every part. You know, if you have nephrology or dermatology or even orthopedists and things like that involved in your care, that everybody's coordinating, everybody, you know, your rheumatologist, I always joke that we are like the conductor of the orchestra, and everybody else with their single organ or their, you know, joints or whatever are kind of all playing together so that we can all treat the patient the best way. And I think, you know, you have to have confidence in your providers. So you should make sure you try to build that relationship.
Thank you. So my next one is the kind of along those similar lines, like what do you see your role and responsibility is in the health and in your healthcare team? Doctors, you're able to just give us your thoughts on that. You kind of touched on some of it, but if you have anything you want to add, and then we'll hear from Jennifer.
I kind of answered that already.
You
Sorry
did.
about that.
No, it was
Yeah.
perfect. No, that's fine.
It's hard. It's very challenging in this disease because it's very heterogeneous, right? So there's lots of presentations and manifestations of disease. And a lot of times we are kind of the initial stop point for or the initial check-in for everything, but we need help from other providers. I always need nephrology in these patients. I never manage this disease by myself when it comes to nephritis. So I think it's really important that, you know, there's great communication in the community of providers where you're working. As a healthcare provider, I mean, I see that across the board. That matters, right? Because we need to deliver the best care to the patient, and we need to do all the background behind the scenes work and kind of have our own good rapport. So I think that's super important.
Yeah, I couldn't agree more. And one of the things that comes up is we want to get as providers, and we're succeeding with this, is get out of the habit of using, you know, Jennifer and Alicia as our communication. So when we're seeing patients in our office that have lupus nephritis and these conditions, it's not uncommon for us to pick up our cell phones and interact with our rheumatology or nephrology or orthopedic or cardiology brethren. As Dr. Clayton said, this is such a systemic disease that I don't want to use my records, my notes, my electronic medical record communication as the best correspondence. There's nothing better than talking to the patient, and nothing better than talking to the other providers, creating the best care plan. So that's the type of relationship which is so multidisciplinary that provides success all around. Couldn't agree more.
Yeah, we always have the best intentions. We always send the notes through the EMR, but all of us know how that goes sometimes, right? Everybody's on different medical records. Things don't communicate with each other. There's nothing that is better than me calling Dr. Levin and saying, hey, I just saw Militia and this is what's going on. And that happens for us all the time. So
that's a great theme. So Jennifer, do you want to tell us a little bit your perspective?
Sure. For me as a patient, I think my role in my own healthcare is to just be open and honest with my healthcare team, and also just ask questions if I have them. Like Militia said, keeping a logbook or a journal with your questions in between appointments and also just kind of observations is super helpful. And I didn't do that in the beginning either, but I found it to be really useful. Early on in my diagnosis, I, for some reason, gave the responsibility of taking charge of my condition to my healthcare providers instead of actually taking responsibility myself. And I know that healthcare providers play a big role in care, obviously, but they really can't do it all on their own. So I'm the one who actually needs to be responsible for being informed, asking questions, and asking for help when I need it.
Thank you. Thank you. So thank you all for sharing so much. I'd like to take a moment now to have Dr. Clayton and Dr. Levin share some important safety information with everyone. So they're going to tag team this, and Dr. Levin's going to get started.
Sure. So no matter how much success we see, like all medicines, there are side effects. And these are things that we discuss quite often with our patients in the office because we want to have great disclosure and great interaction, knowing what to look for and what not to look for. So like any other immunosuppressive agent that we use for a variety of things, these agents can cause cancer. So we want to do our best to eliminate these risk factors. One of the most important things that we do is sun exposure. While we all like the sun, except when it's 90-some degrees outside, it's important to remember that direct sun exposure can increase the risk from UV light of causing skin cancer. So we always tell our patients no tanning machines, which in my opinion, we shouldn't do anyway, which is why I'm pale. Wear protective clothing, use sunscreen. These things are so important daily activity just to help prevent anything. Also, since we're talking about medicines that inhibit the immune system, like lupus, there can be infections. So without a doubt, we want to tell people what to look out for. And if they have any of these symptoms, fevers, chills, night sweats, coughs, muscle aches, certain rashes, let us know that if we know what's going on and there are these lines of great discussion, we can help figure out what's going on. With that said, like so many other medications, there are medicines and foods that interact with metabolism of these medicines. And this is metabolized through a liver pathway called the CYP3A4, which is a big concept. But medicines that we use for other things, antibiotics, antifungal agents for a variety of things, and even things like grapefruit and grapefruit juice can affect the metabolism of lupus. So we want to be aware of what they are, avoid these things, and if other medication changes are known, let us know so we can adapt accordingly. We talked about early on that diarrhea, heartburn, reflux, cough, urinary infections, and even sometimes loss of hair can occur. All these things are important. So if this is going on, not only write it down in your logbook like we talked about, give us a call, give us a shout out so we can know what's best to do for you.
And as part of kind of the empowerment stuff that we always talk about, always give full disclosure to your provider. So we need to know a lot of details about what's going on outside of lupus nephritis or outside of lupus in general. So always talk about vaccine status, right? So with lupus, you should not get live vaccines. The killed vaccines that are on the market are probably safe, but we, still generally advise that you're discussing that with your provider. And then you also need to disclose all of your health history, which I think a good rheumatologist or nephrologist is going to be taking that history from you. But specifically, we want to know about liver, kidney, blood pressure issues, heart problems in the past. And then I think this, for a lot of you who are our lupus patients, is a little bit of a no-brainer because we perseverate about pregnancy and breastfeeding a lot, but always talk about pregnancy plans, right? Because there are a lot of medications that cannot be used if you're pregnant or breastfeeding, and lupus cannot be used in either of those circumstances. So if you're planning that, we need to know that ahead of time and probably do an alternate path than this one.
Thank you so much. Well, so now I would like to hear some final thoughts from everyone. So is there anything you would like to share? Jennifer?
Just a little bit about my journey. It's been a lot of ups and downs, and right now I'm hopeful that I'll find balance in my life again. I'm really looking forward to what this next chapter brings, and I'm curious about what new things could be around the corner and what challenges I'll need to overcome, and especially what new adventures I'll discover. I'm slowly finding that balance I've been looking for after having a really tough time in the beginning. And I'm learning to let go of things that may not be ideal for me any longer and starting to look at new things that maybe I hadn't considered before or were things I just kept putting off. But I definitely feel more hopeful and happier than I have in the last year or so.
Thank you.
Yeah,
Melissa?
yes, and for me, Ginger, I say it a lot. I just feel like you can do more than just survive. You can live. There are some support groups within, our community, who and others who are on the same journey as you, and you don't have to go through this alone. I also would say this journey is an educational one. So you have to be open to learning your body. A good example I would say is just centering yourself and just, figuring out what's going on with you. You have to be open to new approaches and ways to heal. And in your willingness to learn new things or be open, and also, be willing to persevere through those difficult times, because it will be difficult days, you will find that there is fullness, but beyond this condition. I believe that everyone can foster a meaningful life with a little faith, hope, and determination. You can pursue your dreams and make your own way in the world.
Oh, I love that. That's so great. So Dr. Clayton and Dr. Levan, do you guys want to add anything to that, or any final thoughts?
I think just in closing, it's great to see people succeed. It's great to see the success. It's great to see this much interest on these webinars because people want to be successful. Like anything else in life, whatever the disease is, it's about being flexible. It's about, adjustments, and it's about communication. So I think with those things in mind, having this great open communication, great dialogue between providers and patients leads to success. And clearly not everything we as physicians try is always successful in the first go around, but know that our goal is to find that route, find that success. And sometimes they give us a little chance because there are things that we'll try at first that may not be ideal for some. And there are other things that we tried first that are successful. So it's all about give and take and communication. Great.
I agree. And I would say too, something that I always tell patients is that one lupus patient is never the same as the next. So I think it's great that we have forums like this and we have online stuff and there's Facebook groups and all this other stuff, but just remember too, that your disease is your disease and no one else's, right? And I say that as an empowering thing, but also that it's hard to compare, and comparison so many times steals the joy and excitement out of things. So just keep that in mind. But I think I couldn't reiterate what Jennifer and Melissa said any better. So hats off to them.
Yeah, they're definitely both very inspiring for sure. So I thank you all so very much for being a part of this panel and being so open and honest to tell us about your journey, and to the doctors for being so honest about how you want to see your patients coming in, and the collaboration between you with other physicians. We are going to open this up. I do see a couple of questions in the chat. So I'm going to ask them, and I don't know how, we'll see how this goes. So if anybody else has any questions, you can type them into the Q&A section. But it looks like we have, I don't know that we touched on this. It says, can you speak about COVID, lupus, and I'm going to butcher this word, bebtelovimab? I don't know, that's a generic name for something. Does anybody, Dr. Levan, do you want to take that one? Your hand's up, so I don't know if that means.
I'm not sure it was. Like anything else, COVID takes everyone by surprise, and that's not meant to be a sarcastic comment. There is no direct relationship between COVID, lupus, and lupus nephritis, except that we do know that COVID is a stressful situation, both for doctors, patients, and everyone else. And that stress and infection certainly can flare up systemic disease. Like anything else, if you do have an active infection, that may be a time that we want our immune system to be more active than less active. And certainly with a variety of other conditions, when people do get COVID and they're sick, we may hold medicine or down titrate medicines for the time being until they're feeling healthier again, and then reinitiate that. In regards to the medicine which you referred to, which is really another form of lupus therapy, there are a lot of different treatments of lupus nephritis. And I think the thing to remember here is that there is no one right therapy for anybody. What we're really talking about is trying to find the custom approach for an individual that has the least side effects, the ease of administration, and the least amount of lab checks or compliance issues. So everyone should have that respect of being treated as an individual, finding the right path for them. And for most patients, it's a multidisciplinary approach with a variety of medicines to help get success and a cure if possible.
Thank you. So I don't know if you can answer this one generically or not. This next question is says, how long should a patient be on LUPKINase before deciding they have not responded and should try different therapy? Said in my room, I'm an LN patient. My room mentioned switching me to LUPKINase in the next month or two. So I don't know if that's you guys.
Sure. I mean, I can give a broad strokes answer for this.
Perfect.
So I would say it's in the same way that we answer every question like this. It is dependent on the patient's personal circumstance as far as what their lupus nephritis journey has been, right? because you're going to look at somebody who's a new diagnosis a little differently than you look at somebody who's been on multiple therapies and is going to switch to another drug. But what I would say is the benefit of LUPKYNIS, and I think Dr. Levin and I have talked about this previously, is it works in most people very quickly, quicker than anything I've ever used for lupus nephritis. Would you say that's your opinion too, Dr. Levin?
Yeah, I think that's really, really true.
Yeah.
I think it's an understatement to say the least from our experiences, without a doubt.
You will see most of my patients, in my experience, I have seen their kidney or their urine protein fall within a couple weeks of starting the therapy. And that's not to say that everybody followed that path in the clinical trials, but you should be seeing early response for the most part. And I think when your doctor will decide that this is success or failure really depends on this individual circumstance.
So I think 100% I agree with Dr. Clayton. It's important to have goals, and it's important for us as physicians to set out what our goals and guidelines are. In the world of nephrology with proteinuria reduction, we have two goals. One is lack of proteinuria, which is our goal, and how quickly we get there. And the other is reduction in proteinuria by a half. Usually in most systemic diseases, we're not even checking protein for at least 3-4 months because it's too early to check. Here we're seeing an improvement to a certain degree. In fact, cutting it in half in about 6 weeks. That's pretty remarkable. So one of the things that we'll say is we're expect to see X reduction in proteinuria in a certain time, and within an X period of time, getting down to as low as possible, under 0.5 milligram. So I think these quantification of goals is important because it's not just saying, tell us how you feel, if you're succeeding. It's, look, this is the approach we're going for. Here's the result. Here's the trend in the proteinuria reduction. Here's the stability in your renal labs. You're really responding. Now, that's not to say that in 6 weeks, everyone should respond, but I do expect to see proteinuria reduction to a certain degree in at least 3 months, without a doubt.
Thank you. And then we have one last question, probably have just a minute for it, and it's for the doctors again. And it says, where do you see quality of lupus nephritis care heading in the next 5 to 10 years?
It's a great time for lupus nephritis right now at 110%. And LUPKYNIS has definitely been the revolutionary game changer for us, at least in that realm. I'm hopeful that in 15 and 20 years, when I'm hopefully heading towards the sunset of my career, that'll be a time where we don't have young, well, now older, but people who had lupus nephritis in their 20s who then have to be dialyzed when they're in their 40s and 50s because of their disease. I'm hopeful those days will be gone because we will identify people early and treat them with medications like LUPKYNIS to stop the disease process altogether.
Yep.
I couldn't agree more. And the only thing that I have to say is so many of the patients who succeed with lupus or diagnosed with lupus are on steroids. And I think one of the things that we're seeing now is the ability to get on a lower dose steroid than we've ever had before. Perhaps 5-10 years from now, we'll realize that steroids are important in certain management, but as time goes on, tapering it to a 0 dose would be ideal. So that's something to look forward to and minimize the side effects of that.
Yeah. All right. Well, I thank you so much. I don't know if we have any other questions or if we're at time. Maybe Maggie can tell us where we are.
I think there's one more question.
Oh, I see it. Let's
There,
see.
wanted to see if we had time for that one.
So it says, okay, I'm just reading these straight out of the chat. Several years ago, my nephritis was successfully treated with chemotherapy Cytoxan. Is that still used as a treatment?
I'll punt that to Dr. Levin.
Sure. So like so much else, a lot of our knowledge in all conditions and lupus nephritis goes to medicines that have been around for a while. And Cytoxan was cyclophosphamide, a wonderful agent used in certain conditions. Like so many other medicines that are intravenous and they work well that way, they can be cumbersome. So while it's still used, I think these newer agents like LUPKYNIS, not just because we're talking about it, have really supplemented that with giving us more success, an oral form, much quicker response, and much less side effects. So I think we as practitioners build upon the experience that we've had, and medications like this are based upon those prior experiences, with the knowledge that LUPKYNIS is often used in conjunction with other medicines that we deem standard of care. So without a doubt, Cytoxan has a place. I'm just glad to say, in a good way, I haven't had to resort to that here of late because of the side effects. But all of these medicines are key in finding a cure or a solution for anybody, without a doubt.
And just remember that, again, I can't say this enough, everybody's lupus is different. So there are people who on a new diagnosis have other manifestations that Cytoxan would be the appropriate treatment for them first line. It depends on an individual patient's case.
Thank you. Thank you. Well, I just want to say again, thank you so much to all of our people attending online, and thank you again to our participants, Jennifer and Melissa. Thank you so much for sharing. I hope everyone has enjoyed hearing from Jennifer, Melissa, Dr. Levin, and Dr. Clayton. We thank you for your time as well. And I'll turn it over to Maggie if there's anything else.
Thank you so much. No, I'm just gonna thank everyone for joining us today. Thank you, Ginger, Dr. Clayton, Dr. Levin, Jennifer, and Melissa. Thank you for taking the time and being here today. And just as a reminder for those who may have joined a little bit later after the webinar started, it is being recorded and it will be available either later today or tomorrow online. And I put a few things in the chat there. When Jennifer, you and Melissa were talking about the support that people can find, we definitely have some support groups here at Lupus LA. Hope you'll check us out. But there is a wonderful community out there, and I think you hit on something so important for patients to really seek out that support, not only from one another, but from friends, family, spiritual spaces, whatever speaks to your heart, for sure. So with that, I'm going to wish everyone a very safe and peaceful weekend. Thank you so much for joining us.
All right. Thank you. Bye.
Thank you. Bye.
Thanks.